As a health visitor, caring means to work with the family as soon as a child is born, to support them throughout this child's journey, because every child matters to us.
I'm the first face that a patient sees when they come through the perinatal doors, and respect for me is about greeting people with a smile, and smiles don't cost nothing.
Many of our service users feel very alienated from their community, and inclusiveness can mean helping them feel more connected through activities such as gardening, sport, social activities.
Care for me is about showing our patients that we're there for them in their time of crisis and giving them hope.
For me, caring is when a patient can come to me and say, thank you for fighting for me, for having hope and for persevering with me when I needed you.
Respect is understanding that people come in with needle phobia. We listen to them, we calm them down so that they're ready for their blood test to be taken.
Being the home treatment team, we work with people working with us collaboratively, letting us into their houses. So if we don't respect them, we can't really get in, and we need to work collaboratively with them.
I put the value of respect into practice by working specifically with African and Caribbean community. There's a different culture need also, there could be an English need.
Because I'm not the site services manager here, I think caring is about being approachable, and yeah, I am a friendly face. People come to me with all sorts of problems.
The caring value is not just for individual, it's for their families and friends, because they're equally affected by personal illness.
The core of nursing is about care, and staff within the trust need to feel cared for. If staff are feeling valued, then they will give a better service to patients.
And estates and facilities play a big part in that by making a clean and safe environment.
Caring for me is really ensuring the patients are understanding the medication they're taking.
Incontinence is a very embarrassing condition, so caring is all about being able to empathise with them and to help them to make the right decision to manage their condition.
For me, being caring is when I know my patient cannot come to me, but me making time to go to them to offer the support.
Respect for me is about listening to my patients and letting them know that I'm listening to them.
Inclusiveness is important, especially in a forensic setting. Individuals detained under the Mental Health Act, they are individuals of their own value and they have their own rights which do need to be promoted.
For me, respect is about listening to other people, treating them according to their personality and not their illness.
Many clients are quite sceptical about cognitive behavioural therapy, but I see such a massive improvement in them. It's all about being inclusive, getting people into the service and benefiting from the service.
For me, inclusiveness is about making sure that patients who have had a fall are not afraid to come here. It's a full service where we can help them put their lives back together.
I would say inclusiveness is important to all of us on this unit. We all care about our clients because we include them in everything that we do. We're not just going to ignore them, leaving them in a chair, because it's not like that anymore. We're not on here.
Caring is about when a patient comes up to me and says, "Why are you so interested in my life? I've never had anybody being so curious about the story of my life before."